Greetings, friends and followers. This is Nurses Talking. I am Dale Barzy. As always, if you like what you see and hear, subscribe, leave us a comment, and let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. Today, I am very, very pleased to welcome Sainabou Jallow. Sainabou is currently in Arizona, but based in Georgia. She's a registered nurse. She works in the high-risk postpartum area. She's a travel nurse and a content creator. So welcome, welcome, welcome.
Thank you. Thank you for having me. I'm happy to be here.
It's my pleasure. It's my pleasure. Please tell me why you are a nurse.
I am a nurse because I have a love for anatomy, that kind of science, but I also have a passion for caring for people. And I feel like nursing is the perfect um, crossroads for those two. So it's very fulfilling for me to be a
Yeah.
nurse. Feels
Yeah.
like a calling.
We say quite a few people when I speak to us, and quite a few of us say it is a calling. And I, for me, it is a calling, yes. And I wonder if we get across to other people who are not nurses, who listen to us, what we actually mean when we say that it's a calling. Because, I can't think of words to describe exactly what it is, except to say it is a calling.
Yeah. I feel like a calling though is like something that it just is within you no matter what. Like it's even in the word calling, like you always feel something. So if you're not doing something that you're calling, it's kind of like I don't want to say a nag, but you feel drawn to it, like forever
Mhm,
drawn towards it. It keeps
mhm.
calling you.
It keeps
At least
calling
that's
you.
my experience.
Yeah. And even when you try to avoid it,
Mhm.
uh somehow you end up back there
Because it's a calling. Yep.
because it's a calling.
So if you don't
So,
answer the call, it's gonna keep calling. Yep.
so it was a calling for you.
Mhm.
First of all, did anything else, were you considering it among other things?
So originally, like when I went to school, my dad does business. He's a like he was finance major, so he kind of was pushing me to do that. So that's what I started out majoring in, but it really wasn't my jam at all. Nursing, it wasn't a straight path, even though I've always had this passion for maternal health is my specialty. It's always been my passion or my interest. It wasn't a straight road there. I think after taking some science classes and just kind of really asking myself what it is that I want, nursing just seemed to fit that perfectly. That's how
Yeah.
yep.
Yeah, it's a fit. But what was the challenges for you though?
The challenges for me, like becoming a nurse or once I became a nurse.
Either or both.
Um, becoming a nurse, like when you're in nursing school, there's a huge learning curve. I will say something that really helped me is finding like a good study group. That was a really good um but also just managing and balancing like work time. So working on your time management and just getting everything done. When I became a nurse, it was again really big learning curve. But also, the environment was I started during COVID. So yes, like I started my first job end of February 2020, and then March is when everything went crazy. So it's like, what is it, trial by fire or baptism by fire? It was like that.
Mhm.
That was really challenging starting my nursing career like in the pandemic. Um, it was a lot of anxiety, it was a lot of unknown. And then you're also trying to balance that with just trying to learn your specialty and everything like that. So that was a challenge for me.
Yeah, yeah. And so when you're talking about starting in the middle of a pandemic and the anxiety and all of that, and I know that it was a challenge for all of us, individually, collectively, it's a challenge for the institutions that employ us and things like that. I get that. But the question I want to ask you is, Did your institution make any, I don't say any effort, well, I'd say any effort to help you assimilate in this big, recognizing that you have new nurses coming into it. We have this thing going on. A lot of us don't even really know what's happening, except that we have to be careful with ourselves, be careful with our resident patients, and all of that. How did your institution help to you assimilate into all of this?
I had a residency program. So, paired up with somebody. I know they did we did like a personality test to try to pair us with someone who might be better for our learning style. So they did do that. And they also just try, I think it was with the COVID part, it was a learn as they go.
Hmm.
But they already had the residency in place, and so it was those 2 things were running concurrently.
Okay. Mm.
The institution trying to figure out what to do with COVID, how to support the patients, the nurses. Um,
Mhm.
yes.
Yeah,
Um,
yeah.
yeah.
Well, yeah, I can see it. It had to have been a huge. I can't even imagine it. I have to. I take my hats off to those of you who started in that era because, um, I do. I do. I can't even imagine how it must have been. Um, I went through. This was the COVID, the pandemic, but I worked through like the AIDS epidemic and things like that, and so I kind of remember how those challenges played out. But this was a whole big pandemic, so.
Mhm. Yeah.
So your specialty, and you said your specialty always is maternal and child health.
Yes. Yes.
Why? What drew you to that?
So since I was 9 years old, I saw I was watching, I guess I just came across TLC, A Baby Story, and I was just ever since then I've kind of been really fascinated and sort of obsessed with everything maternal, health related, pregnancy, childbirth, everything with that is just something that just I don't know, it sets my heart on fire just talking about it. Um, and so I always knew nursing school, like when I knew I was gonna do maternal health. I always knew. Now I started in labor and delivery, but now I do mother baby. But I always knew that maternal health was gonna be where, yes, that's where my heart is, forever will be.
Okay. Okay. So there's nothing like knowing you know, people who find their niche very early, I find so impressive. So impressive. What would you like to see change though? Whatever aspects of nursing life do you think you'd like to see change?
Um, I would really like to see some cultural changes in the workplace. There are some unspoken expectations like in a lot of places you're not getting a full lunch or getting as many, enough breaks is sort of like an expected norm. Um
Mm-hmm.
Even some cultural things where I feel like, in the hospital, you have a lot of smart people. And sometimes there can be a little bit of ego there, which can maybe sometimes create an environment where people are either afraid to ask questions or afraid of looking incompetent.
Mm-hmm.
But I would really like to see some of the culture of like the expected culture uh, change in the
Yeah.
nursing. Yeah. Because when it's like that where people don't feel comfortable asking questions or people's fear of being incompetent or being perceived as incompetent um takes the forefront, then that puts even patients at risk. That means the quality of nursing is impacted. It's a domino effect.
Yeah. Yeah. That's a setup for mistakes.
Mhm, mhm. Instead of someone wanting to ask a question, they might be more inclined to just see if they can figure it out when and it would just be better to ask because maybe if you
Yeah.
don't know, it should be a safe space for you to ask and learn and yeah.
Yeah, yeah, yeah. And I think that there are some areas in which people are actually working on creating that safe space. Um, I I expect that it's going to take a while because we're dealing with people here. And as you mentioned the word ego, and this ego is a huge thing. And then there are some areas of nursing, for example, which we glamorize. And in those areas, people tend to feel like there's a hierarchy. I get that. But I guess if we actually work at it individually and collectively, we can get there.
Yes.
We can
Yep.
get there. So, how long have you been a nurse?
I've been a nurse a little over 4 years. Yep.
I was going to ask you okay, so I'll turn that question around. You said you've been a nurse for 4 years and maternal and child health is your thing.
Mhm.
What was your big vision for you in that arena?
So I'm debating on whether or not I want to go back to school. Um, but my biggest thing I think is for me is to honestly, just to make maternal health nursing, like, improve it in some way, even if it's on a smaller scale. So that could be the day-to-day interaction with patients, or like I have a TikTok where I do maternal health education for new moms so that it's not as scary. You have some know what to expect when you go to the hospital. You might get some questions answered ahead of time so you don't have that anxiety. So for me, it's just to impact in some kind of way in that space. I also do like precepting nursing students and new hires. So I really like teaching. So whether that's the content creation, whether that's patients on my day to day, or nursing students and new hires, I see myself doing that. I don't know if I'm going to go back to school and still work and do that, but I see myself just continuing to do that.
Yeah, yeah. Okay, okay. And you answered the question I was going to ask because I was going to ask you about your content creation. What you have a
Oh.
TikTok.
Yes, yes. So I'm
Okay.
taking a break from it now, but I do make content for maternal newborn health content. So just for new moms, giving them tips and things to expect, especially, if it's your first baby, what to expect going into the hospitals, just different ways to prepare, reduce anxiety,
Yeah, yeah,
improve. Yep.
yeah, yeah, yeah. And even if it's not your first, because things change so quickly.
Oh,
Things
yes.
change so very quickly, that even if it isn't your first, the tips are useful.
Yes, yes, yes.
Yeah,
It's
it's
really
absolutely.
fulfilling when you get that feedback and they're like, "Oh my God, thank you so much." Or, this, like you said, even if it's not their first, this is my third baby. I never knew that. Or yeah.
Hmm. Yeah, yeah, yeah. Things change and babies change. They don't all come out the same.
Oh no, every pregnancy, every birthing experience is different.
Different,
Yeah.
different, different. Yeah, yeah. So you're recently out of nursing school. You have a little bit of experience under your belt, and actually you started in a really traumatic time. So what advice would you give to someone who wants to be a nurse?
Um, for someone who wants to be a nurse, I would say that they need to make sure they understand their why, and their why needs to extend beyond money and job security. Because when you do nursing, you are taking care of people. These are people's loved ones. These are human
Yeah,
beings. So if you're there for the money, your patients can feel that. And that's gonna reflect in the care that you give. Um, so for somebody who's looking to get into nursing, know your why, and it needs to extend beyond money and job security. You get those things, those are benefits, but that can't be the only reason you go in. You're taking care of people.
yeah, yeah. You're taking care of people. And we see that and we say very often when we say we're taking care of people, we see the person, that we're
Mhm.
taking care of, but forget that this person is not in a vacuum. This person has parent, a husband, a child, a sister, a brother, a cousin, a friend, you know. We have all of these people really who are influenced or affected by the way we take care of this person.
Yes, yes. And another thing with that is that when people come into the hospital, they're very vulnerable. Whether
Mhm.
they're in the hospital for something traumatic or a bad time or some they're really sick, or they're in the hospital for something happy like having a baby, it's still a very vulnerable and sensitive time. And so you have to
Yeah,
keep that in mind when you're taking care of your patients. Yeah.
yeah, 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 indeed, indeed. So, speaking of taking care of patients and keeping things in mind, what would you say then if you could tell me what is the most essential quality of a nurse? To you, what you see as the most essential quality of a nurse in one word, what would that word be?
I would say humanity. Um,
Anything. Okay.
Because I think humanity encompasses like kindness and compassion. I know compassion is sort of like when you think of nursing, those two words kind of go hand in hand. But I think
Yeah.
humanity I feel like very encompassing of those things. Again, you're taking care of people, human beings. There's humanity that you have to have in taking care of
Yeah.
someone's loved one. Um, and being able to relate, being able to have that compassion and yeah, that I think
And
human.
empathy.
Yep,
Hmm.
yep.
Yeah,
Mhm.
exactly. So, what do you do to take care of you?
For me, even though I I talk a lot, I like to recharge by myself. So
Mhm.
whether that's doing an activity by myself or just really just enjoying my own company. Something else that helps me in terms of like filling my cup is I had to learn to have boundaries
Mm.
um, to protect myself because, again, with it being a very vulnerable time, there's a lot of emotional things going on. And if you take that all in, then it's going to start to wear and tear on your spirit. This is where you start to see like compassion fatigue and things like that. Especially, during the pandemic when it's so chaotic and that, people were passing away and it was just such a crazy time. The anxiety, everything. I had to learn boundaries, um, to be able to take care of my patients and have that empathy and compassion, but not to take on, um, everything to protect myself in that way. Yeah.
Yeah, yeah, yeah. There is that word boundaries is really huge.
Mhm,
It's really huge, and it's something that we all have to learn, like kind of individually,
mhm,
because it's not really something that you start out in your life really actually knowing.
mhm.
And I'm going to speak about nursing because that's where my whole life has been. There's no education about it. There's
Oh.
nothing, you go through your whole nursing school and all of your focus, all of what you're told, all of what is brought to you is outward. Everything is to the patient, to the families, to the community, to everything is outward. No one says anything to you about you. And you don't even realize that you're left out of the equation until it hits you in the face.
Mhm, yep, yep. Until
Yeah,
you're now kind of like, "What is going on?" or "Why am I feeling this way?" And this is where you see the burnout happen.
yeah,
This is
yeah,
where nurses burn out because, if you don't have if you're not aware that you need to create those boundaries, then, you're not gonna do anything towards doing that. Knowing is half the battle. And if you don't know there's a problem, then
yeah.
you don't know to address it in the
You
first
don't
place.
know.
Mm.
Exactly. And for many of us, when we know, it's when it's way late.
Yep, we're
The
burnt
re-
out. We're
yeah,
already
yeah,
it's already yep, we are already burnt out.
yeah, yeah. We have gone through the stages. First, we didn't recognize it. We didn't understand it. It wasn't even anywhere in our consciousness, so we didn't recognize it. And we go through the stages of, we abuse food, or we abuse alcohol, or or even abuse exercise, or we abuse, you
Mhm.
know, and it isn't until you're actually flat out that you realize, wait a minute, I am totally burned out.
This is, during the pandemic, that's what happened to me is I started to get sick.
Mhm.
I started to physically take on the stress that I was holding in. I mean, like losing hair, like I started to physically get sick. And so it forced me to be like, okay, hold on, wait a minute. One, I'm
Yeah,
too early in this career. I really love it. I see myself doing this. That's where I had to learn boundaries. That's when I realized it was a problem. But I got sick from it.
yeah, yeah, yeah. But fortunately, I think that we're talking about it more.
Mhm.
Here a nurse is talking. I speak to every single nurse about it. Many people, like you, have already recognized what they need to do, but I think that we really, really have to articulate it, and we have to think about it. It cannot just become, something that may or may not happen today. No,
Like that.
just as we have breakfast or lunch or dinner, just as we make sure we drink enough water, just as we do whatever it is we do, it has to be part of our consciousness daily.
You have to be conscious of it and intentional. Because
Yeah,
if you're not intentional, then you're just gonna end up anywhere the wind takes you. And then
yeah,
by the time you look up and realize you're like, oh my God, how did I get here? Yeah,
yeah, exactly, exactly. Sainabou, I really have enjoyed this conversation. Before we go,
yes, ma'am.
any words of wisdom you'd like to leave us with?
Words of wisdom. Nursing is a beautiful, beautiful profession. The world is your oyster. I think you just make sure you're getting into it for the right reasons, that you're getting into it to care for people. And yeah, like just know that if nursing chooses you, that's a blessing. It's a blessing to be able to be a part of people's experiences.
Yeah.
Yeah.
Yeah, it is a blessing. That is a blessing. Thank you so very, very much for talking to me today.
No problem. Thank you for having me. I really enjoyed talking to you.
My pleasure. My pleasure. And friends and followers, join us next time as we talk to another nurse somewhere in the world, showcasing nurses around the world. Bye bye.
Bye.